behind me.
Okay, the flag is there. All right.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning, everyone.
Good morning.
Good morning, Sheriff
Good morning.
Cummings. How are you?
Welcome.
Thank you for having us
Glad to
at
do
your
it.
lovely facility here in Warren. This is wonderful. We are having our meeting here because, number one, we have this great relationship with the sheriff, and we wanted to meet with him. And I think it's part of our duty that once a year we, since the jail and facilities are under our auspices.
Tutelage.
Yes, our tutelage, that we come and make a visit and make sure that the sheriff is doing things on the up and up.
Everyone's happy.
Everybody's happy, as happy as they can be in a correctional facility. So, how are things?
Good.
Are there anything you would like to
No, everything
touch
is
upon while we're here?
everything is running well here. Despite our
Is that the coffee?
budget cuts.
Yeah, she
Oh,
can
yeah.
come in.
Hi.
I'm your guest.
We always put it right on this counter there.
You can help yourself.
Okay, great, thanks.
We're down about 45 people. We haven't hired anybody in 2 years. The only people we're hiring are dispatchers and nurses because they're kind of one for one. So that's that's had an effect, and we're shuffling people around. If someone's in training and someone calls in sick, then that person goes and works inside. So we're saving money that way. And actually, I think we're probably one of the few still remaining county sheriffs that are going to go into 2010 without a deficit in 2009.
Excellent.
And I do credit the staff that we worked real hard on. And we started early. I think a lot of it, we're told every year there's not going to be any money. You're not going to get a cent, but every year we do that. But this year we felt was a little different, so we started way back to try to save some money. I think it paid off.
Weren't you proactive about 2 years ago and asked for an internal audit in order to address a lot of that stuff?
Yeah,
And that's what's paying off, right?
Yeah. And we're actually, on top of all of that, next week we have a national group coming in here from the American Correctional Association to do an audit on the entire place so that we can get a national accreditation. And that'll save us with insurance and liability issues. It'll be the first time that this Barnstable County correctional facility has been accredited. The old place wasn't even worth the effort because it was just architecturally it in the past.
Right.
So we're excited about getting that done. Other than that, hopefully the state takeover with transfer legislation will take effect October 1st. I know the conference committee is meeting today for the first time on it, so once they get it passed, then we should be able to move forward.
It looks
with
very.
I think it's going to happen.
It looks very much like a sure thing. It's just that they're ironing out those last couple of details there. Mark,
I was just going to say, you have your budget for that interim period, just from July 1st to October 1st.
Right.
We just got an email, and you guys were actually CC'd on the email, and I think it was 7 million.
Right.
Something.
Right.
So, but that sounds a little bit low.
It's always low.
Yeah.
And I think these excise that they say we should get is a little bit high.
Yeah.
Right.
But I mean that's the norm. It's always we're always on the short end of the stick. As far as distribution of those funds. They did say that they would pay the first half of the retirement and health care as part of
quarterly
this.
healthcare, first half retirement.
Right. And then the second part would be paid directly to the county from the state after October. And they had put that in the budget. They had put the funding for our insurance and health care is separate.
In your budget, the state budget
Yeah.
line item, and then that's what the governor vetoed because the legislation hadn't passed.
Right.
So it sounds like that Pat had asked earlier whether there were some budget issues that we needed to sit down and talk about this way. It sounds like 90% of them are worked out.
Right. And we're actually, when I went up to the county government finance review meeting Monday, I guess it was, and we are going to talk to them now, start talking to them now about, there are some, a section in the law that allows us to keep retained revenue. So I spoke to Mark about this last week. My fear is that even though the law might say we can keep it, when the state takes over and they come down to sweep everything, they're just going to sweep everything, and then they'll say, well, geez, we can't do
That's
anything
what you
about it
get,
now,
right.
it's gone, you know. So we're looking to try to protect, especially the communications fund before that happens.
Right.
So,
And we have all those in separate funds. I mean, there's a general fund for the sheriff where we put the state money and all that, but for his other funds, we have a separate special revenue fund set up. So we're hopeful that, you know, the state will say, all right, we'll set the general fund up for that, and everything will go in that, and then they'll set up these separate accounts so that you can put that money in.
Just so I understand, when we're talking about the communications fund, you know that there's been a great concern as you go to the state that,
The CMET.
that we would, you know, that the fire chiefs and the police chiefs are very concerned about maintaining a confidence that they'd be supported by the system that they participate in. Is that the communication fund that you're talking about?
Well, it's certainly for that purpose. I mean, it's money that the towns that we dispatch for pay to us, and then the money we get from towers, renting space on towers. You know, so that's why we want to keep it, so that we can, you know, just have it here. I mean, some of those servers and stuff over there, if they go down, it's like $25,000, and you can't wait for a bid process or appropriation or all of that. I mean, it's an emergency, and you got to have the money to get it right away. You know, so that's our main hope. But you know, I think you know, for whatever reason, it seemed that some of the folks in public safety here in the Cape thought that when we went to the state that the issue with the CMET thing would be resolved, and there's no funding in the transfer of a takeover bill for that. And they seem to think that if we stayed with the county, you people would have come up with the money for that. And I know, you know, we know that you folks don't have that kind of money either, you know.
Well, the farm is working real well, but the money tree is not, you know, not really developed
Yeah.
yet. Right.
Yeah.
My understanding is the Senate President was down here last Thursday, Friday, and both days actually, and we talked about the CMET, and her staff is pretty much on it, Laura Tassinari. And what she tells me is that the Senate President has contacted the Director of Public Safety as well as the Chief Fire Marshal for the state and others. And her office is trying to build a sort of coalition, if you will, to try to get legislation that will then pay for this. And in fact, I think there's supposed to be a meeting next week in her office of the various people to try to work this out. But it seems as though it's going to happen at the legislative level rather than anywhere else.
Yeah, we have met up there once. You know, everybody involved, Cape Cod Healthcare and the fire chiefs and DPH was there, and you know, apparently right now there's no mechanism in the law whereby the fire departments who receive money through the ambulance service on one end, and the hospital who receives money by getting the patients delivered to their emergency rooms can charge the patient. That seemed like a logical, you know, they charge a $10 fee for the hookup, and you know, everybody would have been happy. So that's what they're working on now, is with DPH, is try to come up with a mechanism where they can charge the people in Medicaid or their regular insurance can.
Because this is a statewide issue, right? It's not like ours. You know, everybody has the same.
But there are other ways that don't other municipalities handle it differently, or other jurisdictions, counties.
Yeah. Plymouth, Jordan Hospital gives the Plymouth Sheriff $250,000 a year to provide the service. Bristol County, which just started a CMET operation, they charge the hospital a flat, their hospital is a flat fee, and their fire department's a flat fee. And I think there's maybe one or two others across the state that do it different ways, but they all get some money, you know, from the other parties involved. We're the only ones, and we've been doing it the longest, and we're the ones that they have copied. We just have never gotten anything.
Well, I think that's what the Senate President was saying, that everyone's doing it differently, and there should be one way to fund this that's appropriate for everybody, and it's fair to everyone. And it isn't fair for Jordan to have to pay the full load in Plymouth County. And so anyway, that's what I've been hearing.
I'm sorry.
There's one other general thing I guess we haven't really talked about, it is that you're the public safety officer of Barnstable County right now, and as you go to the state, does that status change? Do we need to name another entity as a public safety officer?
You know, I wouldn't think so. It's basically the same as the DA. You know, the DA went to the state years ago, and it's still a county elected office. And it's basically the same thing. And I mean, the relationship has always basically just been financial, anyhow. So I don't think any of that changes.
I think the big question is what's going to be different and what stays the same.
Right.
Yeah, I don't think anything will be different. Hopefully,
We won't be paying your bills.
yeah. I mean,
Yeah.
I can't
We
tell
might
you,
have a few dollars
honestly, that
more
the
in our
staff's not
pockets,
smiling
but-
about that.
or our payroll. I mean, you have
Right.
all those great things to not have to worry about.
Well, I meant in terms of the services.
And what do
too,
we worry about
really.
after we don't worry about that? We're still worried. We have the maintenance of effort and
Well, we use the main, but actually, what this will do is essentially sever the financial relationship and the liability relationship, I have to say, from us. So, so that's gone. And but I think, as you mentioned, public safety, office, dispatch, all of those we don't foresee changing.
No, as long as the funding's there, and I don't see it. I mean, that's where our legislators come in to help us fight for that stuff.
And then our maintenance of effort is in place to pay for two things. It's going to pay for the unfunded pension liability that will still be out there. But that will be lower, I would think, because the employees that go to the state, the legislation, I think it was in both, I'm pretty sure it's in both versions, waives the 3.8C liability. So really that only limits the pension liability to the retiree, associated with the retirees.
The current.
Exactly,
Yeah,
current
current
retirees. And anybody who's retired before the effective date. There's probably some.
So now it's
in the
October
system.
1.
Yeah.
As
And the other part that's not completely clear is the retirees' health insurance, but the maintenance of effort is there to pay for those as well.
Right.
Those are transferred to the GIC, so it's not clear whether the state's paying for those or we're paying for them. We'll see. But in any event, it probably should be cheaper because the GIC is supposed to be cheaper. So it should, it's supposed to work out the way.
Yeah, and I mean, to the credit of you guys are in a good position, unlike some of the other counties. Some of the other counties are very dependent on what they get from the sheriff's office, because that's basically one of the few things they do.
Right.
We found that out when we went down to Bristol County there. That's with the great fear, if the sheriff goes away, the county goes away. But we're equal partners here.
yes, we are. Hello.
Sorry, I'm a reporter with WXDP News. I'm
Oh,
sorry to interrupt.
okay,
Oh, no,
that's
have a
fine.
seat.
Can I
Have a
sit
seat.
Yeah.
Thank you so much.
But I mean, the way I see it, if there's an issue that comes up through you people and you want me to come to a meeting, you just call me up and we'll at the meeting and get it resolved.
Right.
And,
Yeah, I think that the fire chiefs would just like to have that ongoing dialogue and relationship, so that and reassurance that would come from that, and that we're all working together, and nothing is being done with one hand and not being known by the other. So, and I have no problem with that. Before we're going to be taking a tour, pretty soon, and. I thought that before we do that, you might want to talk a little bit about the facility and what, people look at it as a jail, but I know that you offer services and programs to the inmates, and maybe you might want to talk about some of your programs and that sort of thing. It's a good opportunity.
Sure. Our philosophy here has kind of been if you come here, and we try to keep the staff aware that people aren't sent here. They're sent here as punishment, not for punishment. If people want to work when they get here and they want to try to straighten out their lives, we have programs that they can get into for education and substance abuse and anger management and parenting, and, a whole bunch of things, life skills, and the whole gamut. But if they want to be the type of inmate that you see on TV that's a hard nose and doesn't want to do anything, we have a place for them as well. We've been very successful with our RSAT program, which is a residential substance abuse treatment. The recidivism rate for people who finish that program is about 42% compared to an average of 60%. And we've also found, although we don't have good statistics, that people that come here and get their GED, we've given out about 250 in the past 10 years. We tend not to see those folks. We have a relationship with 4Cs. If they want to continue their education and go to college, we work with 4Cs as well to get that. So it's there's a lot going on. We were talking earlier. We still have a lot of folks that are sent here because they have mental health issues, and those are probably the most difficult people for us to deal with. Because for the most part, they shouldn't be here, and jail isn't a good place for those people that are really suffering from mental illness. So we're trying to work on that, but unfortunately, there's no place to send them. That's usually why they end up here.
Yeah, and unfortunately, there needs to be nationally more of an effort to reduce the criminalization of mentally ill, because typically it's a decompensation that causes an event that comes to the attention of the authorities, and it can be responded to in a medical way, but I think that we've been using the courts, and the fact that you have a facility and it's very easy to let's say to put people into a facility that's available rather than putting the resources in the community to really deal with it. Mm-hmm. One of the things that I know that you've been and my wife have been involved in more directly is the discharge treatment plans that you put out that have been, I think, very important in terms of helping people get back into the community. Mm-hmm. The other program I think you've been involved with is the one I think you've been part of the support of the Bridge to Hope. Okay. Helping women who have been put in the facility get back into the community. It's so difficult especially since the women are single parents and they have to be reintegrated with their family and reestablished with their children. That's a very important program, mm-hmm. and I think people need to hear about the rehabilitation part that's part of the correctional activity mm-hmm. Particularly that you do up there.
Yeah, and I think one of the hardest things to convince people is that most of these folks we only have between 6 and 9 months. And most of them have been having these problems their entire life. So it's not much time for us to straighten them out. We can take care of them while they're here. We can get them sober, and we can get them back on track, and we can get them an education. And when they leave here, everybody leaves with a plan relative to their particular issues. And but we've been working hard on this reentry piece, and for a while there was some funding for it. As a matter of fact, we had a contract with Falmouth Human Services where they were coming in here and they were talking to people before they were released, and when they left here, they were all set up with mental health counseling if that's what they were needed. They were all set up at the Falmouth Service Center if they needed food, and Falmouth housing if they needed someplace to live. And but again, that funding was cut. So unless that cut is overridden, that'll be gone.
How many? What is your ratio of men and women? And you were just saying that some people are here from 6 to 9 months. What is your average length? Is that really the average length of stay of people being here?
The average is about 6 months, but we get a lot of people that might be sent here for 2 or 3 days, so that kind of brings that down. The maximum sentence is 2.5 years. Anything over 2.5 years, they go to a state facility. But that's not to say that we couldn't get somebody for 2.5 years for breaking and entering, and 2.5 years on and after for larceny, so they're actually here for 5 years, but that doesn't happen very often. Yeah.
And your average between men and women?
I can tell you better when we get inside, but probably about 90% men. That we only have about maybe 30 or 40 women is the max. But we're one of the few county correctional facilities that hold women. Most of the counties send their women inmates go to Framingham. We argue that the breakup of the family is something that's causing this crime, and something we have to resolve. And here we are. When a woman gets arrested, she goes, in our particular case, 90 miles away from home.
Exactly right.
So really,
right.
And they just don't. I don't think they get the care and attention because the quantity of people that are a certain time in Framingham.
And what is your the type of crime? What would be your worst, your most heinous crime, and what is the sort of middle of the road, and the average age? I'm just interested in these.
The type of crime is in the jail, which is where we hold people awaiting trial. They're held on bail, without bail. It's the whole gamut: the murderers, the rapists, the whole thing. Right. The sentenced people, those sentenced here are under 2.5 years, and they're only sentenced here by the courts on the Cape. It's anything from getting a lot more driving unders. As a matter of fact, we've started the driving under specifically.
Under the influence?
Yeah, so that, if you're here for driving under, you have an opportunity to go into this program. And we basically just center on the driving under issues. I seen one guy I knew in here that was, I think it was his 5th OUI, and I said, you know, you're gonna kill yourself or you're gonna kill somebody up if you keep this up. And his response was, yeah, I have to quit driving. That's not the right answer.
That's right. Yeah.
So we're trying to straighten those people out, but we have difficulty with a lot of our sentence people because of mandatory sentencing. You know, if they're sitting here for a mandatory, we can't put them on the outside. You know, I can't put them in a work release program. I can't put them in an outside work rule. So they finish their mandatory. Usually, you know, if they're driving under, it might be a year, or a drug case, it might be a year as well, and they go right back to the street.
Oh,
we keep
so
just sending them
there's
right back
something
from
wrong
where
with
they
that.
came.
Yeah.
You know, they're going to end up coming back in.
That doesn't make sense. So there's something.
Average age is about 29. Last time we checked. The racial breakdown is a little bit higher than that of the community. You know, I think we're probably 75% white and 25% minority.
Right.
But we haven't really haven't even looked at that in a while. We should probably update that.
Right. Well, it's our population as well.
Yeah.
That's
Well,
sort of
actually,
it reflects.
Our minority population is about less than 5%.
Yeah.
How does the decreased funding affect your work crews, the work release program? Are you having to do less of it than you did before?
You know, not yet. I mean, I know how valuable it is to the community, so we're kind of struggling to keep it going. But you know, inside the facility, we have one correction officer with 72 inmates. On the work crews outside, I have one officer with maybe 4 or 5 inmates. You know,
So it's more a staffing issue.
Yeah.
I know every time I drive by the Village Green in Falmouth, I remember the time the work crews painted that. They had their picture in the paper too, on the front page to boot.
Well, and actually at the bike path, we provided
That's
that
right,
tent
you
to
did.
keep you out of the rain, and we were there the day before because it was
And took the graffiti.
all over the place. You know?
I saw them there that day.
Yeah, I mean, and another, again, because of the mandatory sentence, we have trouble finding enough good inmates to put out there. You know, we don't, anyone who has a 209A or a mandatory sentence or a CORI, which means someone has to be notified when their status has changed, we try to avoid sending them out there because I know that if we have one problem on the outside, you know, it could end up destroying the whole program. You know, unlike metropolitan areas where they have several newspapers, something happens in a work release program in Springfield and it's on page 47. You know, if it happens here, I know it's going to be on
page 1. Right.
Well, while we've got you on camera, one of the things we might want to talk to you about in the future has been having some volunteers for the rest area to help us out.
That's right.
We almost closed it this year because of
Yeah.
funding, but maybe there's some help that you can give us
Sure.
next year.
Yeah, we're going to start the long-range planning for that in October after we get through the summer season and people are more available to think about how we can fund it for the coming years ahead.
I mean, one of the things we were looking at to keep the community service program going is asking the people who we are providing the service to pay for the officer. You know, so if we could pay the officer's salary every day, I mean, they'd still get 4 or 5 people, you know, without having to pay for any labor. So, you know, we are looking at that, but that'll kind of be a last resort because we do a lot of churches that just
The housing authorities.
Yeah, I was going to say,
that would be a good
benefited from painting
That would be right.
things we've done.
Right, as did Wellfleet when they were moving their fire
station.
Their fire station. You did that in time.
Move the library down
You
to
did everything.
Provincetown.
Yeah.
Do the Pan Mass Challenge when that comes up down there.
Yeah.
Send the crew down there.
Yeah,
do that.
that's this weekend, I think, right?
Yeah.
It's the first weekend in August.
First weekend in August, that's right.
Because they're using the facility again.
Yeah.
Paint a lot
So,
of
That's great
schools.
stuff, Joe.
yes, you do.
Painting a lot of schools when the schools are
Yes.
out.
Right. No, that's great. Well, I'll give you my address when you get down. You know, maybe you can use some sprucing up myself.
That would
we
be
won't
on
let
the front
anybody
page.
know. Yeah, don't want any more.
Yeah.
But anyway, well, is there 30 other questions here, or shall we commence with our tour and?
Yeah, maybe we can think of some along the way.
Yeah, I'm
Sure.
Yeah.
Well, I think what we'll do is we do the tour and then we come back and
we can do some signing, and you
do some signing.
can get back to your job. We have a couple of things we
Okay.
can do if you
Sure.
if you want to get on with your day.
Anything of particular interest? I mean, a good tour takes a couple of hours.
We don't have 2 hours.
It's supposed to meet the requirement of
Yeah.
visiting the jails and...
Oh, I guess this is what we're doing.
Yeah.
So we are visiting the jails. Is there anything that we do want to...
I guess if there are any significant areas that deserve attention... then
Yes,
this is
something
the
you'd
time.
like to show
Something
off.
that we can support you with.
Dispatcher.
Supposed to be aware
Yeah,
of any-
particularly the dispatcher.
Yeah, maybe the
Dispatch,
dispatch, I
red
think
area.
people would be
Well,
doing
dispatch
that.
isn't here.
Yeah.
Yeah, it's
not
not
here.
here in the building.
Yeah,
No.
but there is central control in
Central
there.
control,
Yeah,
that's
that
central
gives you
control. Yeah,
a good view of the
yeah.
entire place.
If you guys want to go down to, might be able to take them down to the fire station.
We can go over there, sure, if you want to go over there. It's not a problem.
That's a nice thing
Oh.
to see.
Yeah.
Is that in the same building?
Yeah, we
No,
can.
but it's
When we're
not that
done,
far
right,
away.
we could drive, when we're done, we could drive.
Okay,
Is it
okay.
north, the fire station?
No,
or-
it's in the base. Actually, at the
Oh,
old
it's on the
fire
base.
one.
Oh, it's yeah. Oh, well, it's the owner's fire station.
Yeah.
Oh, okay.
I have to remember. Yeah, but that's okay.
All right, we got
You
to
gonna go?
Okay, I'm ready.
I'm going to talk to Maggie for just a second while you guys...
Okay. So.